caused the AIDS epidemic in quite some time now. And as we've turned our heads away from HIV, the numbers in Michigan have been on the rise. But tonight, 7 Action News reporter Naya Harden shows us how doctors want to get the word out that no one ever has to contract HIV again.
In Metro Detroit, more than 11,000 people are living with HIV, and more than 40% of them are living in Detroit. If only there was a way to prevent HIV. Doctors say there is. HIV.
HIV does not have a face. It does not discriminate. If you're having sex, you're all at risk, even regardless if you're married.
In Metro Detroit, there are thousands living with the virus.
Some people think, HIV is transmitted through saliva. Some people think you can still get it from kissing. Some people think it's casual contact, and that's so not what it is. And there's so much education needed around it.
Like community activist and mother of 4, Chanika Hodges.
I was in a monogamous relationship for 2 years, but didn't find out till after I was in another relationship. That's to go to show you how tricky HIV is.
In 2015, the Michigan Department of Health and Human Services reported just over 15,000 people living in the state of Michigan with HIV. In 2016, it was nearly 16,000. Nearly 5,000 are living in the city of Detroit alone. The state says Detroit's rate is nearly 4 times higher than Ingham and Saginaw counties.
They are more worried about other STDs and things like that, but HIV seems to be a taboo topic, around sex and diagnosis.
Dr. Jonathan Cohn with Wayne State says there's a growing problem with teens and young adults, especially in the African American community.
Safe sex is less important than having sex. Being aware of prevention methods is less important than being aware of other things that their friends are involved in.
He says many of those cases could have been prevented if people knew about pre-exposure prophylaxis, also known as PrEP, a pill that prevents you from getting HIV.
We're really eager for people to know about PrEP and to take it.
I just take the pill once a day. It's just like a multivitamin.
It's been around for years, and the state of Michigan has been doing a campaign. But community health worker Christopher Woolfolk, who's been on PrEP before, says the word is still not getting out.
I think there are attempts for visibility for the medication, but I think that people are so unaware of it that if they just see the word PrEP, they're not really associating it with anything else.
It's not as easy to get. Patients on PrEP have to check in with their doctor several times a year.
It's better than having no coverage at all. That's how I look at it. That's what I tell clients when I speak to them about it.
It's even hard to get doctors to talk about it with their patients.
Not everybody jumps at it, and I think part of it is the technical training.
Something the state is trying to change.
Break stigma and remove the ignorance, but the biggest key is more education.
For parents, that means talking to your kids about sex.
If you want your children to be safe, it's better to talk about it than to avoid it.
I'm not only existing with my diagnosis, I am living. And I want to thrive, and I want other people that are living with HIV to thrive.
If you